Good afternoon, everyone, and welcome to today's webinar from Mindful Philanthropy. Today's webinar is focused on a new frontier in mental health philanthropy. Before we get started, I'd like to go over a few housekeeping items so you know how to participate in today's event. At any time during the webinar, you'll have the opportunity to submit your questions to today's presenters. To do so, just type your question into the Q&A at the bottom of the control panel. As time allows, the presenters will address as many questions as they can during the presentation. We will be recording the presentation and we will share the link with you after the event. And now I'd like to introduce Barbara Ritchie, the Executive Director of Mindful Philanthropy. Enjoy the presentation today. We're so glad you're with us.
Thanks, Allison, and welcome to all of you. It's great to see all your faces here. I want to give a special thanks to our founding partners and funders, the Scattergood Foundation, the PEGS Foundation, Wellbeing Trust, and the John Heller Fund. I'd also like to thank the Center for High Impact Philanthropy for being one of our knowledge partners. Mindful Philanthropy's founders have been on the front lines of funding mental health and addiction and community well-being for the last decades. And they have seen firsthand how this complex area of grant making has long been neglected by the broader donor community. Last summer, a group of us gathered at Paul Heller's house on the Chesapeake Bay, and Paul is our founding chairperson of the board at Mindful Philanthropy, and you'll hear from him later this hour. And we brainstormed about how we could increase the amount of impactful funding in mental health and addiction. The stakes are too high for society to not have effective funding in an area that touches so many of our lives. At the Chesapeake, we committed to share our knowledge and networks with others, and we went on to launch Mindful Philanthropy this past May. Our mission is to work with donors to strategize, advise, and convene in mental health and addiction, and ultimately increase the amount of philanthropy in the sector. So today I'm inviting you to join us and be part of this startup effort, donating to Mindful Philanthropy and spreading the word about us. Together we can drive more impactful philanthropy to support those living with mental health and addiction conditions. And our goal is to raise $200,000 by year end, starting today. So I'd like to get the session started with an audience poll. So the polling question is, how much has COVID-19 related mitigation measures and other current events impacted your mental health this year? Has it had a major impact, a minor impact, or no impact? The Kaiser Family Foundation did a survey where they asked Americans the same question. They did the survey in March, and then they did it again in July. And in March, 32% of Americans reported that their mental health has been negatively impacted due to worry and stress over coronavirus. In July, that number rose to 53%. So let's see, according to our very unscientific poll, we have a winner. 51% of you have said that COVID-19 and the related mitigation measures and the current events this year have had a minor impact on your mental health. And 49% have said it's had a major impact. And nobody has said that there's been no impact. So let's think about this as I take out my calculator. We have 328 million people living in the United States. Oh, do you want to share the results there? Okay, there you go. We have 328 million people living in the United States, and US foundations give less than $1 billion to mental health and addiction in any given year. That's less than $1 billion for evidence-informed direct services, system capacity building, research and innovation, and policy and advocacy. And that's less than $1 billion to support around 164 million Americans. If you look at our poll, those who've had a major impact. So there's this gigantic mismatch between need and funding. And that's why we started Mindful Philanthropy. We can do better. You and I, all of us can do better. So at this point, I'd like to introduce our first speaker, Kristen Ward. Kristen is here to talk about the gap in funding and how philanthropy can best support mental health and addiction challenges. Kristen is a social impact fellow at the Center for High Impact Philanthropy, where she was the lead author of Health in Mind, a philanthropic guide to mental health and addiction philanthropy. This week, Kristen and her team are releasing additional donor guidance regarding COVID and mental health. And we're so grateful because Kristen has played a key role in helping Mindful Philanthropy leverage the lessons learned at University of Pennsylvania. So welcome, Kristen.
Thank you, Barbara. I'm excited to be here today to share and give you all a sneak peek into the forthcoming guidance from the Center for High Impact Philanthropy that will really expand and specify the work that we released earlier this year called Health in Mind. At the Center for High Impact Philanthropy, we are a source of knowledge and education to help funders around the world do more good. And we do so by answering the question, how do I use my money to do the most good? And that's whether you're an individual or an institutional funder for any set of social issue areas. And we approach issues such as behavioral health, strengthening the US democracy, supporting women and girls, or early childhood education. So we're very agnostic to the issue area. We're just trying to help funders have the greatest impact with their money. And that's whether you have $100 or $100 million. In 2018, we took up the issue of behavioral health, building off of work that we had previously done on lifting the burden of addiction. Behavioral health conditions, including mental health and substance use disorders, are the leading cause of disability in the world. 1 in 5 people experience a mental health disorder, while 1 in 10 experience a substance use disorder. This affects over 1 billion people in the world, costing over $1 trillion. Yet, only 2% of global government funding is allocated to this issue. They're a root cause for so many other issue areas, such as educational attainment and supportive families. It's an issue area that intersects with poverty and the criminal justice system, with homelessness, and so many other areas. Yet, as Barbara mentioned, only about 1.3% of foundation funding goes towards mental health care, including addiction services. Even more strikingly, this is only 5% of the foundation funding that is allocated towards healthcare, which accounts for about 25% of all foundation giving. So it's a huge need that is only rising as a result of COVID-19, and yet there's so little funding that comes from philanthropic sources for this issue. Mental health and addiction are on our minds like they've never been before. Because of COVID and the associated mitigation factors and issues that we're trying to use to mitigate transmission of the virus, people have been increasingly aware of how mental health and addiction influences your daily life. It's been on our minds every day while we're working at home, learning from home, or just experiencing disconnectedness from our colleagues, our friends, our families, being unable to spend holidays with those that are closest to us. Or for those people who have lost their jobs or are experiencing financial uncertainty and insecurity, mental health is impacting us in a way that it never has been before. And we expect that an additional 75,000 people will lose their lives as a result due to drug and alcohol misuse and suicide. This should be a call to action for philanthropy, such an opportune time and philanthropic opportunity to support these issues. In February of this year, based on work that we have done with our partners at Scattergood Foundation, PEGS Foundation, AmerisourceBergen, and the John Heller Fund, we released work called Health in Mind, a philanthropic guide for mental health and addiction. In this work, we highlight 5 strategies where philanthropy can approach or intervene in these areas to have the greatest potential for impact. They include focusing on young people, supporting those with the most serious disorders, including serious mental illness and severe substance use disorders. We include groups of people that are most affected, so those that have the highest rates of mental illness and substance use disorders, to address the specific barriers that can make care more accessible for these groups. We also note how funders can approach expanding access to the care delivery mechanisms and other tools that we have to support individuals who are already experiencing mental health and substance use disorders. And then lastly, we highlight opportunities to transform the landscape, where funders can really use their philanthropic funding as risk capital to engage in higher risk efforts that can have potentially transformational change. So after launching this work, we're getting some really good interest and excitement, and then COVID happened. And as a result, support for these issues quickly skyrocketed. And there's a clear demand for more specific guidance so that funders can think about supporting mental health and addiction in the age of COVID. As a result, this coming week, we are sharing guidance that is taking the work that's outlined in Health in Mind and applying those same giving strategies that you can see on our website to the growing mental health and addiction needs that are emerging and continue to grow as a result of COVID-19 and the economic crisis and kind of uncertainty that our country and world are experiencing. In this guide, you'll find those 5 strategies just updated to be specific to the current needs of, for example, young people and their families. Kids are spending more time than they ever have been before at home. And for some kids, that's great. Some kids, home is a safe space for them. And for others, it's really not. And school and access to teachers and coaches and other people provides a release for those children so that they can continue to learn and grow and adapt in a safe environment. For those people with the most serious disorders, social isolation is the last thing that we need. We call it social distancing, but it really should be physical distancing. We need to engage in social connection so that we can help those individuals with serious mental health disorders and substance use disorders to really avoid that moment of crisis where they end up in ERs or jails. There are also groups, again, that are more affected than other groups. And we've seen this, especially this past summer, as our country reckons with the issues of racial inequity in our country. People who are from communities of color or experiencing higher rates of involvement in the criminal justice system or have other interconnectedness to education, limited education access are also more affected by mental health and substance use disorders. And there are specific strategies to engage these groups to support them and increase access to the resources that they need to live happy, healthy, thriving lives. We also outline how today in this world where we are limited in our access to providers in person, philanthropy has an opportunity to increase our access to those services and those tools through things like telemedicine, things that may have already been available in limited capacity are so much more available today as a result of COVID-19. And then lastly, crisis breeds opportunity. It breeds innovation. There's a moment now to fast forward, to speed up the innovation that has been occurring over the last number of years to respond to the discrete needs that COVID-19 has elevated in mental health and addiction. So with that, we're very excited that we'll be sharing this guidance this week, and we hope that you engage in this guidance and learn more of it. Please let us know if you have any questions, and I will turn it back over to Barbara to introduce the panel.
Thank you, Kristen. As you were talking about social distancing, I think your puppy was feeling a bit of that being locked in the other room. So as you heard from Kristen, mental health and addiction challenges are on a steep incline. And the areas have been historically under-resourced, but there is a lot of hope here. There's a lot of attention being paid. And that's why Mindful Philanthropy is here to help close that gap in funding and strategize and advise and convene donors. The strong network of partners that we have, they've already invested in building the foundation to bring more resources into the sector. And some of those partners are here today to talk about why they're involved and what matters to them. So I'd like to welcome 4 esteemed panelists right now, starting with Kat Risqueta, who's the Executive Director of the Center for High Impact Philanthropy at the University of Pennsylvania's School of Social Policy and Practice. Tyler Norris, the CEO of Wellbeing Trust, Dan Gillison, the CEO of the National Alliance for Mental Illness, and Joe Pyle, the president of Scattergood Foundation. And Joe, I'm going to start with you. So for over 30 years, you've been on the front lines of philanthropy and mental health in Philadelphia, and you're known for really pushing the envelope and being a thought leader. Why was it important for you to fund the health and mind work and then build upon that to create Mindful Philanthropy?
Good afternoon, everybody. And Barbara, thank you for that question. I think Kristen laid out the case very nicely about why Mindful Philanthropy. We know there's a tremendous need. It's an area that is underfunded, not only in philanthropy, but in government and in other areas. So obviously we need to move to increase funding. I think the other important case that Mindful makes is there are multiple pathways to join the work. There's not just one way to become active in philanthropy in the area of mental health. And I think as Kristen outlined and Health in Mind points out that there are multiple ways to join the work. I think the other piece that comes out of our work is this notion that I think is Mindful can be a tremendous accelerator, that often we sit in a silo by ourselves and we don't think there are other folks that are interested in the work. So I think it serves as a tremendous accelerator. I think, one of the things in our journey as a foundation in the last 15 years is that, we've seen ourselves as being a small funder. We're about a $30 million foundation. And when we started, we were about 14, 15. And I think that what one can see is that it doesn't take a lot of money to create impact if you create a network around you. And I think that, very early on, we chose to build a network, to work with others, to partner. And I think in that partner, we were able to drive, impact really beyond our dollars. We were one of the, if not the first foundation in the country to fund a full-time behavioral health reporter on public radio here in Philadelphia. We created a program at the University of Pennsylvania Medical School for applied ethics in behavioral health. We've been funding trauma work, and we've created 2 volumes of how can philanthropy think about funding in the trauma space that have been featured by RWJ. And we worked with Patrick on parity early on. And now we work with PEGS, Tower, and the Lee Foundation doing policy work. So I think that what that highlights is that if you don't need a lot of money to create impact, if you're willing to partner with others and to look at the work at different levels. So to me, the idea of Mindful made perfect sense. And I think that to go back to your survey, if we added the issues of racism in America and the stress of the last 6 months, I think you would have had 100% of people say that mental health has impacted us in a significant way, a major way. I guess just one other thing before I turn it back to you is that I think one of the things that COVID has done is that it has worked to destigmatize mental health. I think that survey is a really good example of the fact that, often, people didn't want to raise their hand and say that I suffer from anxiety or depression or that I've experienced a loss. And I think what COVID has shown us is that all of us are experiencing some level of anxiety, depression, and loss. And so I think that it has normalized the ability for us to talk about mental health, because too often we thought of mental health as that other. It was more serious mental illness, the homeless outreach work. But I think that COVID has really, taken away some of the stigma, allows us to talk about it. And I think, the scary part about more of us talking about it is there's greater need. And that greater need is we need more funding. So we need more people to, become active in the behavioral health philanthropic space. So I hope that answers your question.
Yeah, thank you, Joe. And I think I'm glad you talked about the size of your foundation, because you can pack a really big punch. You don't need hundreds of millions of dollars to do that. So let me turn to Tyler. Tyler, you're the CEO of Wellbeing Trust, and a pretty new organization launched in just a few years ago, actually, out of the Providence St. Joseph Health System. And you started with an initial endowment of $100 million. And then you had an additional 30 million to fund specific opportunities in California. And in a short time, Wellbeing Trust, invested deeply and developed so much knowledge and pathways necessary to achieve a state of mental, social, and spiritual health across our nation. Can you talk about what you've learned in these last few years and how that's influenced your approach to grant making?
Sure, Barbara, thank you. And so great to see 125 people join this conversation live right now around the frontier of mental health philanthropy. I really want to pick up where Joe left off and what Kristen said. That frontier is enabled by how many more people understand, to Joe's point, that mental health is all of us, not 1 in 4, 1 in 5. Mental health is 100% of us looking at this. And Kristen did such a good job of putting out the challenge that this frontier must be a time when we not only bring more money into the mental health field, but we are able to target it towards what the evidence base and the emerging evidence is showing actually works. And that really brings me to how do we create the impact? So Wellbeing Trust is thrilled to be a co-founder and a seed funder of Mindful. And for us, what we see Mindful becoming is what has been long needed in the field, as has been discussed. When Providence St. Joseph Health and our board challenged us to save 100,000 lives from deaths of despair, and you heard Kristen talk about the doubling over decades and even more deaths with COVID, perhaps an extra 75,000 deaths of despair in this period. We had to ask the question, what could have enough reach, intensity, and duration, or dose as we talk about it, to actually turn that tide, which was doubling rates every year, and in fact, not only save that many lives, but increase the well-being adjusted life years of more people in America. And so with the Pain in the Nation report, which we released with Robert Wood Johnson Foundation, Trust for America's Health, and the CDC, we started to unpack, well, what's underneath that? The hopelessness, the loneliness, the isolation. To Joe's point, of course we have serious mental illness, and we have to address that in a very focused, meaningful way, including for caregivers of those with serious mental illness. But right now, half of us are showing moderate to mild anxiety or depression. We're falling back in our addictive patterns, et cetera. So this question said, we've got to function in a very different way. We set out a goal to get the care right. In other words, what is integrated whole person care? No wrong door. Secondly, to increase affordable access to that care, get it paid for? And third, how do you create the conditions for well-being in the first place that you're not ever creating more and more demand for mental health and addiction care services, which we know we're always going to need some of, but how do we stem the soaring demand? So we set out some years ago with our advisory council in reverse engineering social movement theory. What could we learn from suffrage, the environment movement, civil rights, marriage equality, and identified 7 major themes. And I won't go into these in great detail, but they had to do with policy. So we helped start Inseparable with other partners to take off the gloves and be a 501c4, to partner with the CEO Huddle, partner with groups like NAMI and National Council and Mental Health America and other philanthropies to advance evidence-informed state and federal policy. We helped start the WIN network to help create the vital conditions for well-being in the first place. But one of the preconditions of a social movement is that it has funding engines. It has ways of bringing fresh money into the field and targeting it at what works. And I have to say that with incredible respect to the good people in the field, what Mindful is becoming was fundamentally missing. So what we're thrilled about right now is we look at ensuring that the movement infrastructure is out there for communications in partnership with the Mental Health Coalition and Kenneth Cole, with Inseparable, with the Wellbeing in the Nation Network, with ASAM on standards, with the springboard work on pathways, is that Mindful is helping create a field of practice whereby we're more clear about what works so that high net worth individuals, philanthropies, either new to the field or existing, can have confidence that what they're about to invest in alongside others is going to have a dose sufficient ability to measurably improve health. And so for us, Mindful is an essential part of an ecosystem to ensuring that we save 100,000 lives from deaths to despair in the next decade, that we turn the corner on the deaths to despair, and particularly during COVID, that we build a culture of understanding that it's all of us and that there is no health without mental health.
Thank you, Tyler. I always love hearing you talk about this sector. You've brought such a great holistic approach and convened so many stakeholders around the country. It was really needed, and we're grateful to you. Let me turn to you, Kat. You have an overarching view on philanthropy. You're a trusted source of knowledge and education to help donors around the world do more good. Can you speak to how mental health and addiction fit into your portfolio of work?
Sure, happy to, Barbara. And, when I heard you pose that question, I immediately thought of something that Paul Heller, the founding chair of Mindful Philanthropy, frequently says about our team's work. Sometimes I wonder if there isn't more than a bit of annoyance behind it, which is the thing about the Center for High Impact Philanthropy is they don't have any favorite children. And what that means is, for those of you, my fellow panelists on this in this event, who are deeply committed to addressing issues of behavioral health, mental health, and addiction. And I know all of you, many of you in both your professional and personal lives, the fact that the Center for High Impact Philanthropy doesn't prioritize it as the most important issue can be a little annoying. But the reason I'm here and the reason we have dedicated resources to clarify, to illuminate how philanthropy can make a bigger difference is because after 13 years of working across so many issues, whether it's effective disaster, how can philanthropy better respond to natural and man-made disasters? How can philanthropy improve early childhood outcomes? How can philanthropy reconnect disconnected youth? How can philanthropy address all of the harm done by the economic downturns? And this is both domestically in the US and outside the US. When we looked at all of those issues, behavioral health and having better ways to address it is part of how philanthropy can help across all. So, I guess what I would offer from the Center for High Impact Philanthropy's work, where we are truly agnostic as to the cause area or population that we will develop guidance in, is that issues of behavioral health, mental health, and addiction, you can see that theme throughout every piece of work that we've done and across all the populations that we know philanthropy is trying to help. Right. So that's why I'm here, and that's why Kristen has been leading our health and mind work for the past couple of years.
Well, thank you for that, Kat. Dan, I want to turn to you now. You're the new CEO of the National Alliance on Mental Illness, which is the largest grassroots nonprofit organization helping families and individuals living with mental health challenges every day. NAMI has helped my family for 25 years with knowledge, support, mentorship, and NAMI's huge. You have over 600 local affiliates, 48 state chapters. So I'm really glad you're joining us today and representing the grantee perspective. You know, in mental health, we always say nothing about us without us. So thank you for being here. And maybe could you share a little bit how you came to this work?
Thank you very much, Barbara, and I appreciate it very much. And Mindful Philanthropy is just incredibly important and very targeted. And I love the science of it. And Kat, we're going to keep working on you because you mentioned the theme. I liken it to a thread through a quilt, and that is what this work is. Barbara, answering your question, how I came to this is after 32 years in the private sector, this was an opportunity for me to give back. And in giving back, in 1986, I lost my contemporary who I grew up with she lost her life to suicide. From 1986 to 2020, my family's never talked about it. I know the ripple effect of what that looks like for a family. I think about that every day in this body of work. This is an opportunity to give back. This is an opportunity to make a difference. And this is an opportunity to work with the best minds that are very focused on mental health and addressing mental illness.
Thank you, Dan. Well, NAMI's lucky to have you. You just joined in January, so you jumped into the frying pan feet first. Well, I'd like to now do a second poll of the audience. Let's see if the question can come up. And the panelists can think about this as well, because I'm going to ask you similar questions. So what concerns you most about COVID-19 and mental health? Is it loneliness and isolation, the long-term impact on young people, job loss and financial insecurity, homelessness, or racial disparities in health? So as we're waiting for everyone to plug their answers in, for the panelists to think about, I'm going to ask you, these issues and others, like how have the challenges changed as a result of the events of this year for you? And there have been so many events. Okay, people are still voting. Interesting. So we're tied between loneliness and isolation and the long-term impact on young people. Let me share the results here. As being the top two concerns about COVID-19 and mental health. That is followed by racial disparities in health, and then job loss and financial insecurity, and lastly, homelessness. That's interesting, because housing insecurity is a huge issue in this country. But let me turn to the panelists now. And again, Joe, put you in the hot seat and go to you first. In Philadelphia, what are you hearing from your community? What are you hearing from your grantees? Joe, can you unmute yourself? Thanks.
Sorry about that. When I talk to our grantees that are serving young people, they've moved to technology, obviously, as everybody has during these times, to be able to do the outreach and the work they do with children, that their utilization has actually gone up. So again, one of the byproducts of COVID is that we're learning that telehealth, telepsychology, telepsychiatry is a platform that young people are embracing. There's actually been decreases in no-show rates. So, we're seeing utilization increase during this time with young people. But I think that's also leading to caregiver fatigue. That when we talk to our grantees, they talk about the fact that their therapists are working, 12 hours a day. That the need is far outstrips the supply of qualified staff to serve that need. So we have a workforce issue that's coming up. But we also are seeing that as we take down barriers to care, which technology has done, we're seeing increased utilization for kids that way. I think that the other thing that we're really seeing, which is interesting, is partnerships and alliances are forming. And I think that, caregivers that are interested in thinking differently about solving problems are embracing new ways to work with other partners. So what's been great is we've seen strength in numbers that way, which I think is really powerful. Like, how do you work now without there being a school? How do you provide those after school programs? How do you have to provide services? So there's a lot of creativity that's being unpacked, but often that creativity requires additional staffing, or again, not to keep harping on technology, but how do we use technology? I think the other thing that we're seeing on the philanthropic side in Philadelphia is that, we get a call and somebody would say, we're interested a little bit in behavioral health as a foundation, but we really don't know whether it's something we should be doing. And we'd spend time with folks, but it typically didn't go as far as I would have liked it to go. And now what we're seeing is foundations reaching out to us to want to be partners, and not particularly 100% in the behavioral health space, but they're starting to see that our ed funders in the region are saying, we need to think about how we're going to integrate behavioral health into our educational funding programs. They're thinking about it more comprehensively. And I think what they're also saying is that we've missed the mental health part. And by building the mental health part into our education program or our workforce development program, we're going to have better outcomes. So I think, again, if you want to see the silver lining in the pandemic, I think what people are looking at mental health and substance use disorder work differently than they have, and they're being more solution oriented. Because I think, though there's one thing, we've not had the funding we need, but I don't think we've also had the creativity and the programming that we need to really create structural change in outcomes. So I think those are would be the two key takeaways, that adjacent sectors in philanthropy are starting to pay attention to improve their impact. And I think that on the provider side, there is this concern I have about caregiver fatigue, but also I think what we're seeing is folks are partnering in ways that they would not have done 18 months ago.
Thanks for that, Joe. And you mentioned caregiver fatigue, and that's a huge thing. And I'm actually going to pivot to Dan on this, because NAMI is there to support the caregiver as well as the people that are managing the illness, who are living with the illnesses themselves. When my family and I worked with NAMI in the past, it was always in person. And it's really hard for me to imagine getting that support online, but you're being forced to deliver support online. How are you seeing, loneliness and isolation and caregiving fatigue impact your families and individuals that you help?
Yeah, Barbara, we have been and always have been a high touch organization, to your point. So for us to now have to pivot and do it digitally and do it virtually has been a big change. The upside to that we've seen is our ability to touch more and to include more. So it's allowed us to be more inclusive and to also move with that new currency called speed. Now, one of the other things that we've done is we've created a frontline wellness initiative because, to Joe's point, we are concerned about the caregivers, and we're concerned that while we know that we have a workforce issue in terms of the demand is high, supply is low, so we need more caregivers. Well, while we go get more caregivers, who's going to make sure we retain the ones that we have? So, and who's going to shore them up? So what we're doing is we're working on that frontline wellness initiative to support the frontline workers and to make sure that those caregivers have resources. So we're standing that up, and we're doing that with technology as well. So the technology has really given us the opportunity to reach out to more. Also, even with our convention, we had over 12,000 attendees at our convention this year from 34 different countries. So we were able to touch more people and really address stigma and address solutions. So we are seeing a tremendous benefit from as much as we can. But we also know that when the opportunity presents itself, we will have the hybrid of technology and high touch.
Yeah, that's something to be really hopeful about, that this telehealth and telecommunication are here to stay, and we're just going to improve it, as the years go on. So Tyler, I want to ask you about social isolation. I mean, you spent a lot of time thinking about community well-being and the social, mental, and spiritual health of people. And, we're experiencing a second wave of COVID right now. We're anticipating transitions at every level of government in the coming year. I mean, how are you thinking about mental health and where you're going to be grant making and how to support efforts in the coming year?
Everybody is acutely aware of this experience of layered crises right now, right? Obviously, not only COVID, but the economic and social fallout, climate, this extraordinary time of racial reckoning, a political drama that continues to play out, all of which is adding to people's sense of struggle and uncertainty. So if you take whatever underlying mental emotional health, addiction issues were already there on the table, particularly those with serious mental illness, those with serious mental illness may be even more equipped with competence to deal with this than many others who are finding themselves further under. So I think that, just as we were talking about earlier, the universality of the mental health challenges that we're experiencing, and the recognition that this is not a partisan issue, it's not a geographic issue, it is a universal American issue, actually poses us for probably some very important work in the time ahead. And I say that for a few ways. One is that a divided nation is going to need local solutions and state level solutions. So I think one of the things we've seen, we sure saw it when we put out a report with the de Beaumont Foundation earlier this year on actionable strategies for mental health and well-being in the time of COVID. We saw red, blue, just forget it. It's pragmatism on communities stepping up to take action, from access to care, to housing with wraparound, to access to food, to housing, and a whole array of structures. So I think we're going to see a lot of local action. I think that the nonpartisanship of this broader issue, or its transpartisanship, if you will, spanning across is going to lend itself, hopefully, to not only action around some kind of a COVID package or stimulus, which hopefully is in the range of $2 to $3 to $5 billion, just to help the existing behavioral health providers right now be able to fill in the backfill of such increased demand with economic shortfall. And then in the next Congress, given the broader understanding of putting some real dollars out towards mental health, which has been very, very long neglected. I think that the country right now, in terms of what we're seeing and we want to double down on, is exactly what happened in California roughly 6 weeks ago. Governor Newsom signed California SB 855 into law. It is a new gold standard for what enforcing mental health parity looks like. So California, alongside Illinois and other states. In California, it expanded access to 13.5 million Californians, which based on some data could save 22,000 lives. from deaths of despair. So now that we can see Illinois and California and other states, Texas, what is working, I think we can see that kind of increased access. And I think the WIT decision and others is a reminder to the insurance companies that the mental health parity law is the law of the land and it will be enforced. And that the opportunity for providers, payers, purchasers to get ahead of all of this by what does excellence actually look like in ensuring access to care of the law of the land. So I'm excited by the kind of local action across the country that will be properly tailored to urban, rural, red, blue, whatever politics this nation is looking, local action, state standards of gold standards, and federal policy that both now during the time of COVID and ongoing could put real money into mental health. Being part of a healthcare delivery system, I will tell you, and it builds on what Dan just said, our caregivers are so beleaguered right now, the 120,000 caregivers inside Providence. It is all they can do to hold their lives and families together while bracing themselves for this. And because of inaction, they're just going back to double and triple duty right now. Our healthcare providers are scrambling, not just with the PPE, but to meet the needs, the emotional needs of our providers, which I think is going to help our care delivery systems recognize that everyone in this country is just a half a step behind our technical caregivers and first responders of needing that kind of support. If we're going to have a strong economy coming out of it, it's because we've invested in the mental, emotional, and total well-being of the American people. That's what's going to give us a strong economy, a chance of real economic renewal, and make sure that our people are ready to raise families and grow businesses and be community members. I think this is the decade for action on mental health and well-being.
Yeah, I agree. I mean, in spite of all the challenges, there's hope and optimism in the mental health community because there's a movement building here towards a common goal that we have never seen before. And it's going to stick because people are lighting up to the fact that they need to support mental health and addiction for our country to heal. So I want to do a quick round of questions, another poll for the audience. This is our last one. And it's about looking ahead to 2021. What are you most hopeful about in terms of mental health, addiction, and well-being? And I'm going to do a sort of speed round for the panelists so they can think about what they're most hopeful about. But is it the attention on mental health and addiction and the need for funding? Is it the realization that mental health is part of overall well-being? The accelerated innovation in mental health and addiction that Dan alluded to or spoke to? Or the spotlight on racial equity and health disparities that we can finally address? It looks like just the realization that mental health is part of overall health is going to be the winner here. And that's so great because I know people like Tyler are working towards integrated care, meaning, you go to the doctor's office and you can get support for any kind of mental health or physical health challenge you have. So yeah, the realization that mental health is part of overall health is number one, followed by the attention on mental health and addiction and the need for funding. Well, that makes me happy. That might have been a leading question. Spotlight on racial equity and health disparities, number three, and then accelerated innovation is number four. So thank you. Let me do a quick speed round with our guests here. Kat, sorry, you've got to unmute. What are you most hopeful about? It could be one of those questions. It could be something else.
So what I'm most hopeful about is coming out of the fact that COVID is unlike any kind of disaster, natural or man-made, that the nonprofit and philanthropic sectors have ever faced. And many of my fellow panelists have talked about why. Probably the biggest one, it's a global pandemic. It is literally global. Normally, when there is some sort of crisis, we have the benefit of a global supply chain, and there are some communities that are affected and some communities that aren't affected, meaning there's a kind of separation between the helpers and those who need help. And as Tyler and others have said, that doesn't exist. The people you would rely on to help are also struggling with the effects of COVID, as are those who are desperately in need of help. And because it is a global pandemic, the disruption to our global supply chains, and in some cases, including the United States, the lack of a federal coordinated response means that it is particularly challenging and we don't have the tools we normally have. But to answer your question, the bright side of that is that scale of need is forcing funders to finally adopt practices that people have recognized were going to help all along, even pre-COVID. And those are things like speed and trust. When the need is so acute, people get that we need to work faster and figure out how to trust each other more, because you can't move funds without trust. You can't act without trust. And so I think there's a recognition that we've got to, as funders, we have to trust our grantees more. We have to understand who they're serving, how they intend to serve, and give general operating support or emergency funding, because we don't have time to waste. So that is a promising development. The other development that I'm seeing, and this comes out of a project that I know Joe, because he's based in our region, was a part of. Our team developed the first of its kind COVID response dashboard. It covered 10 regions in southeastern Pennsylvania and southern New Jersey. And what it did was it visualized all of the shared funds grant making for immediate relief for COVID across 13 shared funds, and aligned those grants with known need in those communities down to the census tract level. So needs as indicated by COVID death and case rates and the social vulnerability index that the CDC develops. Now, we could have only created that dashboard, which is public and visible to anyone, if all of those shared funds agreed to share their grant making data. So I'm asking, has anybody ever known? It's not just 13 shared funds. Those 13 shared funds were comprised of dozens of funders, literally dozens of funders, real time sharing their data so that others could benefit from it, right? So speed, trust, and a willingness to share information, you know, that old saw, never waste a good crisis. Those are some of the most promising behaviors that I'm seeing coming out of this right now.
Thank you. I love that. Speed, trust, and sharing. I wholeheartedly agree. Well, we just have a couple of minutes left. I do want Paul to come on and say hello. So Dan, what gives you the most hope in the face of these challenges?
Care. Leaders like us daring to care and putting our care into action. In the past, I saw it as rhetorical, more rhetoric. I'm seeing a level of focus, a level of energy, a level of commitment that is much different in 2020 than in previous years in some of my previous not-for-profit work. So we say, you know, people don't care how much you know until they know how much you care. And I just would say that we dare to care, and we're really making a difference now. And I'll just share this with you. We created a COVID response fund, and we saw funders really give us dollars to help make a difference in this space. The other thing is existing funds that we had, Barbara, we were able to go back to those funders and say, we know you gave you gave us this funding to do this. However, none of us expected COVID. Can we repurpose? And their energy and their adaptability to that immediately gave us hope. And I would say that is what we're building on as we close out the year and we go into 2021. We also hope that everyone stays very focused on our communities of color. Mental illness doesn't know pigment of skin. Mental illness is as Tyler said, it's 5 and 5. It impacts all of us. So what gives me hope is all of us being connected and looking to make a difference and daring to care.
Oh, that's great. Thank you. Well, I do want to give some time to Paul because he wanted to come on and say hello to everybody. So we're 5 before the hour. Tyler and Joe, thank you for participating. Kat, Dan, it was so great to hear from you. And I'm going to welcome Paul, chairperson of the board, to the discussion.
Thank you, Barbara. I feel a bit like I was told not to be in the whole show because I'd have been nodding the whole time with a big smile. Thank you to the panelists. I join all of you today as a founding member of Mindful Philanthropy and also as privileged to be the board chair of the group. But I really join you as the father of a father who lost his son to addiction and mental health. And that's why when Kat Risquetta says at the Center for High Impact Philanthropy, we care about all issues equally. We're agnostic as to what you care most about. I do tease her because I care so deeply about this one. And I want to just spend a minute on my background and really more on my son. And I spent a career not in philanthropy and not in mental health and not in addiction. I'm a business person. I had the good fortune of working at an amazing firm. I see some of my colleagues are online. Thank you. At the Vanguard Group. And I just loved it there. Actually, Vanguard was a very focused philanthropic organization. I retired from the senior team almost 5 years ago now. And shortly after retiring, we lost our son, John, who is just such a beautiful, bright connector, such a good person. And like so many, the year my son passed away, 55,000 other people passed away of addiction, just to opiates, and more than that to alcohol. And this past year, over 75,000 have. It's getting worse. And unfortunately, COVID's made it worse. So I'm a member of a club that no one wants to be in. And John was just a remarkable person and a connector. And I talked to some friends and colleagues at the time, including Kat Risquetta and Joe Pyle, really dealing honestly with my own grief. How can I lean into this? How can I pay it forward? How can I get involved? And that's really how I've been spending my years post Vanguard, is largely in the social sector, largely in this space. And I'm so optimistic because there are so many great opportunities out there. I think everyone on the panel talked about this mismatch between how many people are affected, yet how little dollars flow into philanthropy. And it's not for lack of opportunity. There are great things. So Mindful was set up to connect potential and prospective donors to behavioral health issues that need funding. And it's a tremendous privilege to be involved in this space, to talk to foundations, to talk to companies, to talk to individuals, and showcase the kinds of opportunities that are out there for them. We strategize with the best in the business. You've heard from a few of them today to really learn about what's happening. We advise on issues that people care about in their own backyard, their neighborhood, their issue areas, and we connect them to experts. And we launched in a time of COVID. That's been a bit of a challenge, but we've also heard that it's been an accelerant for some of these things. So we're very optimistic. We're off to a really strong start. We've put together a terrific team. We have a rather lovely website. We are out there connecting with people and we're gaining momentum. So that feels really, really good. And we're here today, not necessarily to connect any of you to a particular issue within behavioral health. We're actually here today because we want to accelerate overall funding into the field. And we recognize as this entity called Mindful Philanthropy, who's largely funded by foundations that are in the space, that we can do more, we need to do more, we want to do more, and we have great plans for doing so. And you could be an important part of that if you choose. That would be so meaningful to us. If you make a donation to Mindful, we'll make it easy for you. There'll be a donate button. You can go to our website, etc. You can reach out to any of us. And very importantly, as you come upon people who are affected by behavioral health issues, please think about connecting them into the team. we can talk to them about the kinds of opportunities that are out there really across the country in so many different domains, from brain research to political advocacy to services on the ground. So I want to just close by really thanking you, Barbara, and the team for putting your heart and soul into this work. It's such noble work. It's such important work. And I want to thank my colleagues on this call, who each of you are just so impressive, both in terms of your capabilities and knowledge, but once again, also in terms of your commitment. We have a very aggressive goal. We're trying to raise $200,000 before the end of this year. I'm optimistic we're on our way, and we're hoping this call can be an important part of it. I want to thank the audience. It's 5:01. I'm going to let you go. It's another Zoom call you participated in. I don't know about you, but this seems to be all I'm doing, and it's hard. So I really appreciate the fact that you hung in there. Thank you so much. All the best to each of you. I hope you have a really lovely and safe holiday season. Thank you.